My name is Sherman Loans. I am the Director of the Division of Healthcare Facility Licensure and Certification with the Bureau of Healthcare Quality of the Massachusetts Department of Public Health. With me today is Jerry Page with the Department of Public Health Determination of Need Program. On behalf of the Department of Public Health, I want to thank you for taking time today to participate in this hearing. The Department is holding this hearing on the discontinuance of medical and surgical services at the North Shore Medical Center's Union Campus, located at 500 Linfield Street, effective on a date to be determined following the consolidation of services at the hospital's Salem campus. We are holding this hearing to provide the community with an opportunity to comment on the proposed closure. This hearing is a public forum for the presentation of any comments that may be relevant to the Department's consideration of this matter. Following this hearing, the Department will make a determination as to whether the services to be discontinued are necessary for preserving access and health status in the hospital service area. The Department will consider the evidence presented at this hearing, the current utilization of these services, the capacity of alternate sites to provide the service, and other relevant information available to the Department. The Department will make its determination within 15 days of today's hearing. If the Department finds that the services to be discontinued are necessary for preserving access and health status, the Department will require the hospital to submit a plan for assuring access to the service within 15 calendar days of the Department's finding. The plan which the hospital submits will be reviewed by the Department. The Department will respond to the hospital in writing with either its approval or with written comments to which the hospital must respond. Today's hearing is separate from the Determination of Need, or DON, hearing, which will be held on January 12th regarding the changes proposed at North Shore Medical Center's Salem Hospital campus. On August 7, 2015, North Shore Medical Center submitted a DON application for new construction and renovations of its Salem Hospital campus. As proposed, the DON application is for new construction of a two-story addition on the medical center's campus to house 48 relocated medical surgical beds and a new emergency department. The project in Salem involves substantial renovations to the former Spaulding Hospital adjacent to the medical center to accommodate 120 inpatient psychiatric beds. In addition, the application provides for construction of a new main entrance and a number of ancillary services. This hearing today is being conducted to satisfy hospital licensure requirements. Any person whose intent is to comment on the DON for Salem Hospital should identify themselves after speaking to a representative from the DON program in order that they may be listed as an interested party. Would those staff from the DON program today please raise your hand and identify yourselves? We have several in the back of the room. Written comments regarding the closure of services in Lynn must be submitted to DPH today. There is a separate deadline for written comments on the DON application, which is Monday, January 18, 2016. Written comments on the DON application may be sent to the Massachusetts Department of Public Health, Determination of Need Program, 99 Chauncey Street, Boston, Mass. 02111. Both the email and the mailing addresses for the program are provided on printed slips of paper at the sign-in table in the back of the room. We will begin this hearing with a brief presentation from the hospital regarding the closing of services at Union Hospital. Following the hospital's presentation, we will provide an opportunity for elected officials from the community to comment on these proposals, and then begin calling those individuals who have requested to speak this afternoon. I will be calling speakers by name from the sign-in sheets that we have collected. If you have not already signed in and would like to speak, there will be an opportunity to do so when we have called the names on the list. Please limit your remarks to 3 minutes in order that we may have an opportunity to hear from all who have comments or concerns. You're welcome to leave a copy of your remarks with us at the front table after you've spoken. At this time, I will ask Robert Norton, President of North Shore Medical Center, to make the hospital's opening presentation.
Thank you, Mr. Loans, Mr. Page. North Shore Medical Center would like to thank the Department for hosting this hearing today and for its consideration of our plan to consolidate its campuses. I would like to speak today about our overall plan for consolidation and detail the services and offerings that will be expanded. Healthcare is changing. The healthcare system of the past was hospital-centric, expensive, and focused on treatment of episodic illnesses. The healthcare system of the future is defined by value and redesigns care around the patient, expands access to community-based services, and uses connectivity to organize that care. Over the years, long hospital stays have been replaced with less invasive outpatient procedures and new pharmaceuticals to manage disease. Care has increasingly moved to outpatient settings, and the care that is left in the hospital has grown increasingly technology-intensive and complex. North Shore Medical Center and partners are committed to meeting the ongoing healthcare needs of our communities. We are here today because we truly believe the proposed plan will better serve patients in the future with a regional system of exceptional care. North Shore Medical Center currently operates a 395-bed acute care hospital that consists of 2 campuses located 5.8 miles apart, easily accessible by public transportation. In addition, North Shore Medical Center operates 7 licensed satellites throughout the surrounding communities. This project will consolidate hospital-based medical, surgical, and behavioral health services to create a stronger regional hospital facility for complex inpatient and emergency care in Salem, while expanding access to outpatient, primary, specialty, and urgent care directly in the communities we serve. Specifically, the Salem construction project involves relocation of 48 medical surgical beds from the Union campus through the construction of 2 inpatient units with private rooms and the latest family-centered care. Renovation of the former Spalding North Shore Hospital to accommodate 120 psychiatric beds, relocating beds from both campuses, and adding more than 50 much-needed beds as community resources in behavioral health. This will also support integration of addiction treatment with inpatient and outpatient psychiatry, behavioral health, and community-based services. Construction of an expanded state-of-the-art emergency department with advanced trauma, cardiac and stroke programs, and a dedicated observation unit and pediatric ED services. With improved capacity, operational design, this new facility will reduce waiting times, prevent diversion, and enhance patient privacy. Additional capacity for outpatient services, including relocation of cardiac and pulmonary rehabilitation, ultrasound, and infusion from the Union campus, is also a part of our plan. Reconfigured key access areas such as main entrance, reception, lobby, and a more welcoming patient and visitor experience. We expect the construction at Salem to take approximately 3 years once the project is approved by DPH, and the clinical staff will move with their patients at that time. During the 3-year construction period, North Shore Medical Center is committed to providing full emergency services through our department on the Union campus. During this time, North Shore Medical Center also will study models for the delivery of urgent and emergency care in the future, and will speak with community leaders to determine the best array of these services to meet the ongoing needs of all patients and communities. At present, North Shore Medical Center has licensed satellites that offer outpatient services and/or diagnostic imaging in Peabody, Danvers, Gloucester, Swampscott, Lynn, and the Lynn Community Health Center. Additional comprehensive services are also available at the affiliated Mass General North Shore Center for Outpatient Care in Danvers. These services will remain in place following consolidation. In addition, North Shore Medical Center is working with its integrated physicians and community partners to expand outpatient, primary, and specialty services directly in the community. Central to this plan, our North Shore Physician Group practice, located on the North Shore Medical Center Union campus, will be enhanced and will remain in the neighborhood near the current Union Hospital, if not on the campus itself. This practice has the largest of the North Shore Physician Group's 12 office sites, offering primary care, urgent care, behavioral health and specialty services, endocrinology, gastroenterology, nephrology, and rheumatology. It is a National Committee for Quality Assurance recognized Level 3 patient-centered medical home and includes a complex care management program, a residency training program, nutrition counseling, Coumadin clinic, etc. Consultative specialty services will be expanded as patient need and clinical protocols indicate. This practice will continue to be able to address a wide range of patient needs in a convenient location. The Lynn Outpatient Behavioral Health Clinic will also remain on or near the Union campus. Currently, there are 10 providers and a nursing home consult team serving a wide variety of adolescent, adult, and geriatric behavioral health needs, including access to substance abuse and psychopharmacology services. Additionally, assuming the DON is approved, North Shore Medical Center intends to support expansion of primary care and behavioral health capacity with our colleagues at the Lynn Community Health Center, with the build-out of the third floor of the center to support a variety of community programs and services, with resources for addiction and other community priorities. Our plan is designed to ensure patients will have access to expanded, enhanced inpatient behavioral and emergency care at North Shore Medical Center Salem, complemented by access to primary, specialty, urgent and emergent care and behavioral health services throughout the communities we serve, in our integrated North Shore Physician Group offices and at the independent community health centers in Salem, Lynn, and Peabody. This plan ultimately will result in improved access for patients by keeping the services used most frequently, primary care, behavioral health, and support services, conveniently located throughout the community, and consolidating the most technologically demanding complex care, thereby enabling specialized clinical expertise for high quality and cost-effective care. We believe this plan will provide an exceptional system of high quality, accessible care to serve the North Shore communities for many years to come. Thank you for your time and your attention to this very important set of issues.
Good afternoon, and thank you for being here today. I'm joined by my colleagues in the legislature from the Lynn delegation, and Laurie Ehrlich, who could not be here, as part of a letter that will be submitting written testimony as part of the full delegation. Again, thank you for being here. We are here in strong opposition to the North Shore Medical Center's intent to discontinue providing inpatient medical and surgical services at the Union Hospital campus. If these services and reductions proceed, the City of Lynn, with a population of over 90,000 people, will be the largest city in Massachusetts left without a full-service hospital. Additionally, these changes will result in substantial negative impacts to quality and access of medical care that the citizens of Lynn and the entire region depend on. Emergency room, ongoing outpatient services that are necessary in that location to serve Lynn, but they also serve Lynnfield, Saugus, and Peabody, and it really is a key piece of the region's care, particularly on the emergency and outpatient side, in that location that really the access is so important. It's close to Route 1, but more importantly, it really serves the entire community of Lynn, as well as Peabody, Saugus, and Lynnfield. Additionally, job continuity, and I know that hasn't been much discussed, and the impact of this downsizing, relocation, or elimination of jobs. What does that impact have on both the long-term dedicated employees of Union, but just as importantly to the community that now is served by the Union campus? Our constituents, local officials, elected officials, and other stakeholders have continued to be, over the last several years, in opposition to any plan that eliminates or minimizes medical care in our community's only hospital that we in this community and surrounding communities absolutely depend on. We need to continue an open dialogue with North Shore Medical Center and all of the stakeholders. Over the past year, we've had an opportunity working to make sure that the services and the needs of this community and the surrounding communities continue to be provided for in the future. We've had a chance to meet with and have productive meetings and collaborations with the Attorney General's Office, the Massachusetts Health Policy Commission, Department of Public Health, local, federal officials, advocates, and constituents. This is an important issue. You will hear it. I'm not going to speak much longer. You have a lot of people here that are going to articulate why this is important and why it's important for our community. Again, we appreciate your time and efforts and your willingness to be here, and more importantly, we look forward to working with you and ensure that the quality of care that we've been able to depend on for the last many decades will continue in this community. Thank you very much. And I'm going to leave this written testimony so that you have it on record. Thank you. And again, I just want to recognize Representative Bob Fennell, Representative Brendan Crichton, Representative Donald Wong, and again, Representative Laurie Ehrlich, who will be part of that submitted letter. Thank you.
Thank you, Senator.
Good afternoon. I'd like to thank the department for coming to Lynn today to hear the concerns expressed by our citizens and by the people elected to represent their views. I, too, like Senator McGee, will be very brief. But I noticed in Mr. Norton's opening statement that he referred several times to this as a matter of consolidation. I think that I would prefer to see this and think of it as a matter of isolation. And that is because of the geographic nature of the area that is being considered right here. Union Hospital is currently on the westmost side of Lynn, along with Ward 7. Lynn Hospital is located in Ward 1. Although Mr. Norton correctly states that it is 5.8 miles as the crow flies from Union Hospital to the Salem campus at North Shore Medical Center, that 5.8 miles is sometimes almost impossible to travel during a rush hour. I'd challenge anybody. I would challenge anybody to take that route at 3 o'clock on a Friday afternoon and tell me if you come anywhere near the average time that is expressed for that trip to have supposed to be made. I feel that in addition to that, we can't improve the infrastructure to improve the travel times, and that is because of geographic limitations. The city of Lynn has a pond system that would make it impossible to find another route from Linfield Street out past Wyoma Square without having to contend with the pond system. And for the people in Ward 7, they have a 2,200-acre parcel of land that is not accessible by vehicle in Lynn Woods. I think that the travel time, where we know that sometimes a matter between life and death can be a matter of minutes, that travel time makes this a very dangerous plan for those 90,000 people who live in the city of Lynn, as well as the approximately 50,000 other people who are serviced by Union Hospital that come from the areas of Linfield, Peabody, and Saugus. So I thank the department for listening to all of us, and I hope that the North Shore Medical Center will reconsider their plans once all of the testimony is given today. Thank you.
Thank you, members of the Department of Public Health. I'm going to have to bend over a little bit. I apologize. Welcome to the City of Lynn. If this is your first time here, please feel free at the end of the session, which should go long, to visit one of our nice, wonderful, fabulous restaurants in the downtown area. And if you haven't been back here, the auditorium, thank you. And if anyone here hasn't been in the auditorium, please come back for a wonderful show and or a concert. It's the best venue money can buy. For the record, my name is Dan Cahill. I'm the City Councilor at large here. I'm also the City Council President. And I am here to speak in opposition to North Shore Medical Center's request for a change of essential services as well as the determination of need application. A number of my colleagues on the council have asked me to speak on their behalfs. Councilor Buzzy Barton is unable to be here tonight. He has to attend a funeral, as well as Councilor Jay Walsh and Councilor Peter Capano, who have work conflicts. And Councilor Diana Jacutis is present with me in the audience. We'd like to have their names also recorded as being in opposition. And while we understand that this hearing is concerning the essential services closings at Union Hospital, I, along with the City Council, would like to be party of record for the determination of need application that has been filed by North Shore Medical Center. First and foremost, we support the preservation of a full-service hospital here in the city of Lynn. And as Senator McGee has alluded to, there have been numerous meetings held either in the community, amongst interest groups, amongst folks at the State House. There are a number of people, as you can see behind me, with a vested interest in what's happening at Union Hospital. And they're folks that aren't going to go away quietly. The folks behind me want a full-service hospital because it's important for them, their families, their children, and their loved ones. Although there have been a number of issues raised to me, and as you can imagine, 90,000 constituents that I have, you get a myriad of concerns. I've tried to boil down to about 5 important issues that I hear the most in the community. And by the way, note, not once have I heard anyone come up to me and say, Dan, this is a great idea. They're going to close Union Hospital. What a wonderful day in the city of Lynn's history this is. You have to understand, there are not just the folks here, but 90,000+ people out there that couldn't be here tonight that don't want any changes. But should there be changes, which we hope does not happen, there are some questions and concerns we have. An emergency care center in the city of Lynn is critical. Critical. We have people who are disabled, chronically injured, people who depend on emergency services. You don't have to read the paper to know you can look into your own family and friends that there is an opioid addiction epidemic here, not only in Massachusetts, but tragically here in the city of Lynn. And we can't have Narcan everywhere. And a lot of those folks depend on emergency care services to save their lives. And as the mayor pointed out, it is a distance to Salem Hospital if you're in West Lynn and you suffer some kind of episode from an overdose of an opioid. And heaven forbid we lose more people that we're already losing on a daily basis. Transportation has become an issue. If you take away our emergency care and you take away our hospital, well, these folks have to take expensive ambulance rides to Salem. Now, who's going to bear the cost of that? Us? Our insurance premiums? So we're basically going to be paying out of pocket to make the bottom line for North Shore Medical Center look a little bit better on their spreadsheets. I don't think that's very fair to the hardworking people of the city of Lynn that's going to have to be impacted by this. The senator touched on employee benefits. We have a lot of folks who live in Lynn who work at that hospital. The reason why they moved to that area is because they could walk to work. Now, what's going to happen to those folks if they're displaced or sent to Salem? We want to make sure that the Department of Public Health protects these workers, that they keep the seniority rights, that they keep their wages, that they are able to go to work, and they're able to have a job there. Because if they lose their job, well, again, guess who faces the impact? Well, me and my neighbors, because now our neighbor down the street's out of work, and that's not fair to our community. Translation services. Have you noticed here, you have a translator here for folks who are hearing impaired? We have untold amounts of languages spoken here in the city of Lynn. And if they're going to go to Salem Hospital instead of Union Hospital, there better be somebody over there that can translate for them. Because when you're making important, critical decisions about your health care, and English is not your first language, we need to make sure that those patients are protected. And those patients are my constituents. And finally, community benefits. You know, we're going to be promised a lot of things during this whole process by North Shore Medical Center and partners. But we need help to make sure that the department itself or the state hold their feet to the fire. We have been promised many things in the past. This is the second possible closing of a hospital just in my lifetime alone. If there are going to be benefits promised to the city of Lynn, they have to be fulfilled. And we need the help from the state to make sure that they are committed, that being partners, is committed to making sure that each and every promise detailed is carried through. Now, in closing, the Department of Public Health, we ask you that you deny this application for a change of essential services and determination of need. And on behalf of the residents of Lynn, it is imperative that DPH knows that closing essential services at the hospital will impact the accessibility to health care, and this impacts patient safety and the quality of care. I wish you all the best of luck in your hearing, and I hope these folks behind me are able to convince you to make sure that we keep a full-service hospital in the city of Lynn. Thank you for your time.
Good afternoon, evening, ladies and gentlemen, members of the Department of Health, Public Health. My name is Brian LaPierre. I live at 2 Rand Street here in the city of Lynn, and I'm a proud member of the Lynn City Council. Just the other night, on a historic occasion, I took to stage and took my oath of office. Never 72 hours would I think that I'd be here in front of everyone on this matter that's just all-encompassing and so sad to have to take the mic and have to defend against Mr. Norton and their plans for this consolidation of services. I want to applaud my colleagues at the state level, the delegation, Mayor Kennedy, and President Cahill, who began before me. And I'm not going to go over all the reasons why, and I get very passionate about this issue. You know, I've spoken about this several times over the past months, and I'm going to try to keep my emotions down so that, but it's a very passionate issue that we all feel. It's a very tense atmosphere for the people who rely on hospital services. So I'm not going to go over all the reasons why we need a full-service hospital in Lynn. That speaks for itself, along with the greater Lynn region. My position and my thoughts on this matter have been very public, as I have said, and I've spoken at great length during the campaign all last year about this major issue that's facing our city. What I do want to use my time for this afternoon is direct my line of questioning rhetorically to Mr. Robert Norton, the president of the North Shore Medical Center. And I want to ask him rhetorically the following questions. Number one, how can he firmly believe that the changes being proposed will mean better health care at Union Hospital for our patients? Number two, how does he say that consolidated care will translate into better care? Number three, how can he say that by closing Union Hospital and no longer offering vital services, that the care will be in 3 to 5 years better than it is today when we no longer have a full-service hospital? Number four, how can he say that he's not denying his obligation to provide patient rights to care when you're stripping us of our access to hospital and ambulatory care? Number five, if Mr. Norton's goal, I'm sorry, it's not my goal here today to say too much. But I'd rather have you watch and listen, because it's a public hearing and not everyone's going to be able to speak. I'd rather have you watch and listen as I ask the citizens behind me this afternoon, the citizens of Lynn and Greater Lynn, to raise their hands if they would like to see Union Hospital continue to function and operate as a full-service, comprehensive, acute health care facility. By a show of hands, folks. We are all here because we love our hospital. We love our community hospital. We love the service it provides. And finally, number six, my question, Mr. Norton. How can you say that you recognize the concerns and that you're doing your very best to help us understand that it won't have any adverse effect on us, that the care will in fact improve by closing the only hospital in the city of Lynn? These comments by President Norton were made this week in the Daily Item. And I am deeply offended that you would insult our intelligence, sir, by playing a shell game with our health, with our livelihoods, with our local economy and our lives. Shame on you, Mr. Norton. The Partners conglomerate and everybody else involved with this plan has put profit way ahead of people. And I strongly urge the Department of Public Health officials here today listening to deny this proposal in its totality and keep Union Hospital localized and medically intact. Thank you.
Hi, I'm Wayne Losey. I'm the counselor for Ward 1, where Union Hospital is situated. I want to say I am very much opposed to this, and I want to thank the Department of Public Health for holding this hearing. And I really don't have much to say. I'm going to be very brief. I think my colleagues, I think Tom McGee and our state delegation said it well, our mayor, Judy Kennedy, my colleagues. There will be a big void. What we heard tonight from Bob Norton, and I'm going to step out and allow that what his plan will do may very well improve delivery of health care at Salem. But as we heard tonight, you can't get from many parts of Lynn, Linfield, Saugus, Peabody to that location. So you can have the best delivery of health care in the world at that location. It's not going to help if somebody needs that service. And that's what a hospital does. It saves lives. And I would urge the Department of Public Health to deny this application. And furthermore, I would also request that North Shore Medical would reconsider and the plans that you have for what you're going to do at Salem, please try to bring that into Lynn and not allow us to lose our hospital. We can't afford to. We need it. And I would also like to be a party to the determination of need. Thank you very much.
Thank you, gentlemen. Thank you for letting us speak tonight. I also want to thank Senator McGee and his delegation and the mayor. I've been involved with several of their meetings, and it's been quite eye-opening for someone that is not familiar with it to see how the matters are handled by the Department of Health, the Health Policy Commission. And we've been working on this for several months. I also want to thank everyone that showed up here today. The Save Union Hospital group has been tremendous in educating everybody on this, and I think everybody behind me here is certainly passionate about wanting to keep Union Hospital open and express their strong opposition against the closing of Union Hospital. The town of Linfield has 12,000 residents. The town of Saugus, 26,000. The City of Lynn, 92,000 residents. And these are the patients currently using Union Hospital, along with many other outstanding and surrounding communities. Over 30% of these residents, nearly 40,000, are seniors, and the majority of them use Union Hospital for both their primary and emergency care. I'm going to speak about the town of Lynnfield, but I'm speaking on behalf of all the communities being affected. Lynnfield has a senior housing community only a couple miles from Union Hospital. I have a petition in my hand signed by every one of them asking you to keep Union Hospital open. The town of Lynnfield Medical Services have about 1,000 emergency trips a year, of which 600 of these trips go to Union Hospital. Currently, an ambulance can take a patient to Union Hospital in about 5 minutes from the town of Lynnfield. To change that route to the town of Salem and the Salem Hospital, it would add 25 to 30 minutes to the travel time, and that's on a good day. If you try to travel during rush hour, or severe weather, it could be much more. This is simply unacceptable. I met with Bob Norden and discussed the matter with him, and we had a nice discussion, but quite frankly, I'm very confused by the information that he gave me. He had a propaganda packet that describes our plan for the future. In the plan, it talks about better access to services for local residents that use it the most, the expansion of primary, specialty, and urgent care throughout the community. I can't understand how the closing of Union Hospital is expanding those services. Continued access to key services that Lynn residents use most. He describes that as an expand medical home on the Union campus, which is primary, urgent, specialty, and behavioral health care with labs and radiology. Not one word about emergency services. The most disturbing piece of this flyer that he handed out was he gives a map of the medical services in the North Shore, and amongst that map he talks about 2 hospitals, several physician groups, and some community health spots. Nowhere on the map does it show Union Hospital. It's already been predetermined that Union Hospital is not going to be there. He also describes how care will improve. Bear with me for a second. How care will improve. He talks about better access through multiple points of entry, community-based to bring more care to the patient. And here's the kicker, meets the needs of all the patients and the communities. This is false advertisement. This is not true. There's no way that closing that hospital will bring better care. Closing Union Hospital does not give us better access, more care, and it definitely does not meet the needs of the patients of the communities. We discussed the timeline for closing, and Mr. Norton said the construction will take 3.5 years, and Union Hospital will stay open during that time. I then asked him, with the doctors and nurses leaving, being relocated, and with departments closing at Union and being moved to Salem, could he guarantee that Union Hospital would not be closed in less than 2 years? And he said no. And they say they have the same concerns that we have. In closing, I'd like to ask the Department of Public Health to make sure that the residents of Lynn, Lynnfield, Saugus, and the surrounding communities are provided the same level of health care and emergency services we receive today, and insist that Partners Healthcare provide these services at Union Hospital. Thank you.
Our next speaker will be Thomas Terranos, Selectman, Lynnfield Board of Selectmen.
I want to thank the department for having this meeting today. Thank everybody for coming. Senator McGee and your associates, thank you very much for coming today. To voice, as vice chair in Lynnfield, I want to voice my very strong concern and recommendation not to close Union Hospital. And the reasons are very simple. The roadways to and from this facility are what they are. There's no possibility for expansion. There's no way of transporting people from the surrounding communities that will need urgent care to get to a facility in time if this facility is closed. It's very, very simple, very simple. I think about when we look at our people at large, because of the health services we're all receiving, we get to live longer and more vibrant lives, and God bless everybody for that. But along the way comes increased care that's required for everybody to enjoy and continue enjoying their lives as they grow older, and for their young children and grandchildren and great-grandchildren. By closing this facility, you are going to stop that, because people will not get the care they need in time. Our roadways are not adequate to supply the ambulances with the roadway to get to this facility or to an alternative facility in time to be cared for and live through a traumatic experience. When we look at today's day and age, we all live in a very stressful time. The number of people and friends that I have that have suffered through strokes at very young ages, thank God Union Hospital was there to save their lives. If they had to go to Salem or to Melrose Hospital, they may not be here. I am alarmed by the even remote thought of the Union Hospital being closed. The information that we're getting from the hospital, as the chairperson, Phil Crawford, said, nothing more than propaganda. This is merely a financial decision. As a society, we need to care for our health and our well-being and our friends and neighbors and our family. And the way to do that is with a good health facility. I'd like to just make one more comment really quick, and that is, when I grew up in an inner city, not in Lynn, but in East Boston, and I grew up between Central Square and Day Square, much like Lynn, very, very compact. And we had what was called a relief station, very small building for quick emergency care. You'd go there, get stabilized, and you'd get rushed into a Boston hospital. Do you know what they have now in place of the relief station? They nearly have a small hospital in East Boston. And I'm sure you're aware of that facility. I don't know the exact size of it, but it's an enormous building now. This is the opposite of what we're doing with this current situation. Here we're downsizing and eliminating services in an area that's highly populated and difficult to navigate. And in an inner city such as East Boston, similarly situated, they're expanding services to provide better service to the community. To that end, I'd highly recommend that you keep Union Hospital open. Thank you.
Thank you. As a reminder, this hearing today is separate from the DON hearing, which will be held on January 12th regarding Salem Hospital Campus. Any person whose intent is to comment on the DON for Salem Hospital should identify themselves after speaking to a representative of the DON program. In addition, we're going to ask that each speaker limit their remarks to 3 minutes in order that all who wish to be heard have a chance to speak. Our next speaker will be Calvin Anderson, followed by William McGinnis.
I thought this was a DON meeting, determination of need. But you're going to hear a lot of determinations of need. To wit, 3 days ago, I presented myself at the emergency room at Union Hospital. People dripping off the walls. That shows a determination of need. They told me a 3.5-hour wait. Well, I wasn't that bad, so I went up to Salem campus. Another 3.5-hour wait. Now, Mr. Norton, won't that mean in 3.5 years I'll have a 6.5-hour wait? So I have a little friend here. I learned from Councilor Colucci to have a prop with you when you're making a point. He did this at the inauguration the other night. Here's my little friend. He's in a tub. Now, at one time, this tub had 2 drains, one here, one there, because that was adequate for the volume of the flowing liquid through the pipes. So pretend all these suds and water here now are people. Now they're going to one pipe, served by one campus. Now they're going down another pipe, served by another campus. Now his husband comes and he decides to close off one of the drains. Now all this water is backed up, going down one drain. Even the drain might be improved. Maybe there's more parking at the drain. Maybe there's more rooms at the drain, but there's still all the, what we're always talking about, existing infrastructure of highways which are not going to change. They're going to be there. So we're going to get backed up. The same volume will not be able to flow adequately down. So we're going to end up with rings. Now, I know that Partners is trying to build this Titanic up in Salem, but the rest of us are going to be going down with the ship in steerage. If they're doing this the same way that they think that they're doing their neighborhood health care, which is about the worst insurance since Obamacare came out, you try to get a good physician. Oh, they got lists of them. They got lists. All the panels are full. All the panels are full. You can't get a good doctor. You got to wait for appointments. And then they don't want to see you. It's the worst insurance on the face of the earth, and Torchiana ought to be ashamed of himself, and so should Robert Norton. So let's think about the people once in a while. I'm from the 60s. We warned everybody this was coming. Everything's going to become one power company, one food company, one medical company. This is corporate greed, gobbling up, making it easy for you to consolidate. Power to the people, we're the people.
Thank you very much for having this forum. My name is William McGinnis. I live at 22 Sherbrooke Place in Lynn, Massachusetts, and I am a lifelong resident of the city of Lynn, worked in the school department for 38 years, and was principal in the school in the neighborhood of the Union Hospital. So I fully understand the significance of the place and the busyness. When I came in here this afternoon, I've been spending 4 months researching the needs of hospitals and the needs for the people of Lynn, and also to look at Partners Healthcare as a company. And there's a two-faced story here. One is a very dedicated staff of doctors, nurses, and associates, and the other is a corporate organization that doesn't understand its meaning of being a non-profit hospital. I've given them a 5-page document, 4 pages of written material and 1 page of photos, which I'll mention at the very end. The first page, and I'm not going to read the whole thing to you because we don't have the time, but you people will have all the information that I provided. And there are some very great concerns. Number one, Lynn and its neighborhood area is a population of 135,000 people. You heard the Lynnfield Selectmen. You could have the Saugus, some parts of Swampscott, Nahant. It's a bigger area than one would imagine. Because of that, what's happened in Massachusetts in the past 35 years is the closure of 62 hospitals, of which 31 of them are acute care hospitals like Union Hospital. This has resulted in Massachusetts, and probably in many other states, because the World Health Organization has done a study and has come up with the idea that what is needed are number of beds per 10,000 people. Massachusetts right now has slipped below 30 beds per 100, making us less than average. With the recent closures of North Adams Regional, the Quincy Hospital in the 7th largest city of the state, And now Partners wants to close the hospital in the 8th largest city in the state and the 16th largest in New England. That's Lynn. What's that? I'm going to take just a fraction more. I want to get to this. Nonprofit hospitals, there's been a study done, you'll have it, an analysis of the Congressional Budget Office, and it says that that nonprofits try to run away from poorer communities. Kyle Eliason said that the government expects these hospitals to provide free and low-cost care. Remember now, a nonprofit gets tax breaks. The tax breaks are expected to be given to communities that need the help. Instead, it's gone to salaries like Mr. Norton's of $1.5 million to $3.1 million in the partner system. And I'll just finish off by saying to you, how is Partners going to make its money off us? I'll tell you how. They've gone to Dubai, they've gone to Qatar, they're now going, and the pictures that I've given them are 9 pictures of a hospital that will be erected in China, a 500 to 1,000 bed hospital of Partners Healthcare by the year 2017, in which some of the patients will pay out of pocket $300,000 for an operation. That's a nonprofit organization for you. And I'll tell you, we have one thing in common with that Chinese place, and I'll finish. We both have a ferry boat. But I wish you could see the one in Xingdai as compared to the Lynn ferry boat in size. We need a hospital.
Our next speaker will be Peter McKenna, followed by Karen Gromis.
Thank you. My name is Peter McKenna. I live at 97 York Road in Lynn. In my view, there are 3 clear issues. 1, Partners leadership has made a business decision, a financial decision, to close the hospital. 2nd, Lynn needs, for the reasons stated, a full-service hospital to serve its residents. And 3rd, the cost of medical care in this country, in Massachusetts, is out of control. I believe the appropriate action in response to these issues is for the DPH to work with the City of Lynn and the surrounding officials and identify a responsible party to take over the ownership and operation of Union Hospital. Thank you.
Thank you for allowing me to testify here today. Although I've gotten an education on the issues today, before I give my testimony, I want to say it is always tragic when a hospital closes like Quincy Medical Center and North Adams Hospital did. And change is always difficult, but I gave a lot of hard thought to my testimony today. My name is Karen Gromis. I am the Deputy Director of the National Alliance on Mental Illness of Massachusetts. In addition, I am giving testimony as a person who has lived in Lynn for over 20 years. I am also an individual who is challenged by mental illness. I'm here today to support the consolidating plan put forth by Partners Healthcare to transfer psychiatric services to Salem Hospital by creating the new Center for Excellence in Behavioral Health, as well as transferring inpatient services to the Salem campus. I believe that the current plan proposed by Partners North Shore Medical Center at the Salem campus will improve access to health care for residents of Lynn, even for the most vulnerable of Lynn's population. I realize that there is a substantial elderly population in Lynn, but they should feel assured because their primary care physicians and many other services they use will remain at or near the Lynn campus. And although other services will only be accessible in Salem, there is transportation available through services such as those from Gliss and the Ride, which they are probably using to get to Union Hospital today. Although the Lynn campus will no longer offer hospital services after the consolidation, outpatient, primary, specialty, urgency care, and behavioral health services will be expanded at the Lynn location. North Shore Medical Center's Salem campus will be a more advanced, comprehensive facility that will not only preserve but also enhance the services previously provided by Union Hospital, particularly due to the creation of the Center for Excellence in Behavioral Health. This new facility, which will be operated collaboratively with Massachusetts General Hospital, will expand inpatient behavioral health services and, perhaps even more importantly, provide much-needed substance use treatment to the North Shore. In Massachusetts, we currently face a deficit in the number of available inpatient psychiatric hospital beds. The creation of the Center for Excellence in Behavioral Health is a much-needed solution to this deficit, as it will provide an additional 54 inpatient psychiatric hospital beds. This center will also be instrumental in providing comprehensive treatment to patients with mental illness due to its close proximity to the medical hospital. The ease with which patients at the center will receive medical care will be a crucial factor for timely recovery from other physical conditions, as comorbidity is fairly common among those with a mental health condition. I strongly encourage the Department of Public Health to consider the plan proposed by Partners Healthcare for their North Shore Medical Center's Lynn and Salem campuses. As a North Shore resident, as well as an individual with mental illness, I believe that this plan will better serve in providing vital medical and psychiatric services to residents throughout the North Shore. Thank you.
We're going to ask that as we do this, we respect everybody's right to share their opinion. Our next speaker will be Pat Campbell, followed by Robert Nadeau.
Good afternoon. Thank you for this opportunity to address you on a very critical need, that is Union Hospital. I'm proud to say I was a teacher in Lynn for 38 years. And I cannot, though I am a resident of Lynnfield, and I want to share you some of the statistics about Lynnfield, I cannot help but brag about my 38 years here. I was educated here in Lynn. My family owns property, or did until June 8th this year, since 1941. I go so far back with the Union Hospital that I volunteered at the age of 13, and I was cleaning needles. That'll show you how far back I go with the hospital. The hospital has been wonderful for my family. It saved my father's life 3 times. No hospital, no emergency services, for a city of this size, one of the 7 largest in the state, in a state that has the best education in the country. That's not a terribly well-known fact. But we also have medical services that are renowned across the entire world. People fly in to Mass General, a Partners facility, which we're very proud of. It is unthinkable that this community would not have a hospital. I live in Lynnfield, and I would like to tell you some facts you might not know about Lynnfield. A lot of people think of Lynnfield as a suburban community with large homes and a lovely common. Lynnfield has changed a lot since I believe the feasibility study was done. And here, let me take you on a little walk. If you come out of the front door of Union Hospital and you take a left, you will come to Goodwin Circle, now known as Condon Circle, I believe. Right there is Heritage Woods in Lynnfield. It has 40 units of senior housing. If you go and take the next right off the circle, you will find Cedar Pond. Cedar Pond has 90 units. Something you don't even see if you go down Lynnfield Street. Then we pass Pearly Burrows. After we've completed the Rotary, we come to Lynnfield Commons, also not well known because it's fairly new. 200 units. We then go up Salem Street, and there is a parochial school next to Our Lady of the Assumption Church with 348 people there, children from all over the North Shore, and it includes 318 children and 30 staff. If you progress down Salem Street, you come to the Linfield Senior Center. We have visitors, again, from all over the North Shore. The average daily use there is about 175, but on some days there's 250 people. Then we go to Market Street, right off of Walnut Street. It's a whole new development. I'm sure it's before the feasibility study and the needs assessment were done. We now have 650 employees on Market Street and a number of people shopping from all over the state on any given day. There's Windsor Estates right behind the hospital, another senior housing development. And I could go on. There's a lot of development in Linfield that you need to look at. Our students are 2,187 students and 300 employees. We have to be sure that these people are well taken care of in our community. I also will tell you, as some people have mentioned, it has been suggested at some of these hearings that the people from Linfield can go down Route 128. Have you tried it? To go through Peabody Square, especially when it floods, would not be very feasible. I've also discovered today after lunch with someone who works for the city of Salem that there's a new Cineplex going in on Highland Avenue with a restaurant. That's the access from Lynn to Salem Hospital. And they've done a traffic study, and that traffic study shows that there will be 2,500 to 3,500 more cars on Highland Avenue in any given day. I know my time is up, but I could go on for a long time. I will write to you. Please do the traffic studies. Do the needs assessment again. Do the feasibility studies, because I believe since their original plan, it's outdated. We need Union Hospital.
Good afternoon. My name is Bob Nato. I was brought up in Salem, lived there for 50 years, and I've been in Lynn for almost 19. I'm very familiar with the area, every back alley, side street of the city, both Salem and Lynn. I drove taxis years ago, and make no mistake about it. The mayor had mentioned something about trying to go up Highland Avenue, which is the main thoroughfare, which is 107, going towards Salem Hospital on a Friday afternoon. Try doing it any day of the afternoon. I'm there every day. I'm fortunate. I live off of Eastern Avenue, and I'm always going up that street. And believe me, between the backup starts over where Walmart is, because you have lights, the sirens are blaring, people panic, and a lot of them don't know what to do. You have ambulances that's trying to go up on sidewalks, the medium. Now you're coming up by Market Basket. That's even worse. Okay? Now, I know exactly where this woman's saying this built. And that's right along the stretch going to the hospital. So now you go down the hill on another light. Now you've got the cluster there of people trying to make a left, beating the ambulance. I've seen it. I'm there all the time. So now you get down and you go up the hill, start going down which I call the Ho Chi Minh Trail. Believe me, it's horrible. And then you're making a right turn into the hospital. You come from any part of this city, there's no way around it. There are no highways. It's all congested. It's all side streets, people cutting in and out, pulling over. It's just unbelievable trying to get it. Now, I can sit here or stand here and tell you how Lynn Union saved my life, but I guess that's really not the issue here. It was a nurse who saved it, that overrode a doctor who sent me there, is the reason why I'm standing here with a severe bacteria. If I had listened to the doctor, I don't think I'd be here. The nurse is the one that said, I'm admitting you, and she saved my life. But let that go, okay? Now, Mr. Norton's here from the North Shore, president of North Shore Medical Center. I take it he's the president of North Shore Medical Center. Pardon me? Okay. Is there anyone here from Partners, the ones higher up? Anyone here? No? From that committee group that they have, that they meet with? Supposedly they sent this gentleman to be the sacrificial lamb, but so be it. Okay. This, ladies and gentlemen, is all about the money. Make no mistake about it. It's all about the money. Partners has become the Walmart of healthcare. They have all the doctors. They have all the hospitals. What more do they want? Are they making more of their money over in their international dealings? Look that up for yourself. Just Google it. They're all over the place. So, you know, this is about safety. The bottom line is safety. Not taking away from the care, but safety. And let me just say this. Look around this room to any one of us, beside you, behind you. Which one of us is going to die because maybe your children, your loved one, a car wreck on Route 1, a heart attack? Time is of the essence. The medical community will say, it's all about timing. How many times have we heard about that? It's all about the timing. You're not getting to that facility in Salem on time if you close that hospital, all right? And in closing, if anyone here believes that they're going to keep that emergency department open after 3 years, I've got news for you. It ain't going to happen. They're closing it because it's all about the almighty dollar, and they could care a rat's behind about us. With that, thank you very much.
Our next speaker will be Mark Rubin, followed by Karen Adams.
Afternoon. Thank you for the opportunity to speak. And I'm going to be speaking in favor of the application. And, you know, I hope as a physician that I won't be. Can't hear you, sir. I hope as a physician that folks won't boo me. I see a number of my patients here in the audience, and I just want to say that most of them would tell you that I care about taking good care of people and making sure they do well, and I'm going to try to explain why I think this is a necessary thing and the right thing for our community. And I say our community because it's my hospital as well. You know, I'm going to try to restrict my remarks to medical reasons. I don't know a lot about finances. I know about what it means to take care of patients. And the most important thing is that this is going to improve our ability to take care of the complex needs of our patients. Inpatient surgery has changed since I started in medicine. You know, many patients get their surgery done as an outpatient and their medical care as an outpatient, but that means that the ones that are in the hospital are sicker than ever. And when you have these more fragile, complex patients, my surgical colleagues and I were charged with taking out their gallbladder or operating on their cancer, but they also have heart disease, kidney failure, liver problems. And to manage them effectively, we rely on the help of many specialists to bring our patients through our surgeries without complications. You know, and so many patients today are older and they have dementia, or they become confused easily. You know, when getting them through their surgery means vigilance day and night. And it's not possible for NSMC to provide the full range of subspecialists and on-site consultations at 2 locations, but we can provide optimal care at 1. And likewise, we can't have 24/7 surgeons in-house to respond quickly to emergencies at 2 locations, but we can do 1. And, you know, it's going to be better care if we can consult the subspecialists and be quick to get to emergencies, and that's the big difference. A second really important thing is that consolidation will help to build a sustainable model for surgical care, okay? I need to build a surgical team, and recruiting surgeons to this area is tough. The Mass General, Brigham and Women's, BI Deaconess, they're right down the street. And they have all the technology and all of the fancy things that attract young surgeons. We are struggling because we're splitting our capital between 2 campuses. If we had all of those dollars at one place, I could have the technologies, have the special things that attract young surgeons and help to build a team that will be there for us in the future. You know, I've been operating at Union for 23 years. Personally, I've had 2 operations. I chose Union for both of them. Consolidating our surgical programs and our hospitals is the right thing right now. Medicine is changing. I'm really proud to be part of the team. The nurses and the doctors that work at Union and at Salem are the greatest. But this is the right thing for us now, to make sure that we have a great hospital in this community for the future. Thank you.
Thank you for this opportunity. I am a bit disappointed that many people can't be here today because of the early start time, and I think they're going to be disappointed that they couldn't weigh in. That said, I need to say that I'm strongly opposed to this concept of closing the Union Hospital as we know it. It's ludicrous that a city the size of Lynn wouldn't have its own fully functional hospital. We're told repeatedly that this consolidation, quote, will give us better care, quality care. But what good is it if you can't get there from here? I travel all the time up and down the highway that we're going to have to go to Salem Hospital, known as Route 107 or Highland Avenue. And it's a nightmare, even on the best of days. And not to mention the flooding that we often encounter right where Walmart's is. It's just impassable. I can't imagine all of the people that are getting care at Union Hospital right now, including hospitals, trying to navigate that minimalist 2-lane highway both ways. I think the residents of Lynn deserve better. Thank you.
Our next speakers will be Karen Dulé, followed by Michael Toomey.
Hi, it's actually Carol DeLay, and unless there's a Karen here that wants to get up. I'm a resident of Ward 1. I am probably one of the few people here that think this is a great idea to move all services to Salem. I am retired from North Shore Medical Center. Just recently, after 52 years of service, and before that, my mother worked there, my brother worked there, my sister worked there, and my 2 sons worked there. So my heart has always been there. But I think the people today there's several groups. I've been sitting up back watching them. I don't have anything prepared. I've been taking notes. There's the group that are thinking with their hearts. They don't understand healthcare. And this is the hospital where they had their children, and yes, I did too, and where their parents were there and their families, and I've been through that. But healthcare is a business today, ever since Medicare came into being. And healthcare has to have money. And I've been through budgets, and every year it was always cutting, cutting, cutting. I worked at Lynn when we went through hearings similar to this, and everyone said, it'll never work, you can't take the city hospital away, we'll never make it through Ioma Square, we'll all be dead before we get there. I'm hearing the same thing over and over. I want, knowing what I know about healthcare, I want the best care right now. And I live 2 minutes away from Union Hospital. But if I were a patient in telemetry at yes, the care is wonderful. You can't take anything away from the care at Union Hospital today. But if I was a telemetry patient and I was deteriorating and they said, well, you need a cardiac cath, they would say, all right, we're sending you to Salem. So they're taking me out of this comfortable bed, away from nursing care, into an ambulance out in the cold, over the potholes of Lynn, taking me to Salem. I'm gonna have the cath. If it was, positive, then they're gonna keep me there. If not, they're going to put me back in another ambulance and send me back to my bed at telemetry at Union. I don't consider that good quality care. I'd rather be at the regional medical center getting better care. Yeah, I also heard people speak about a full-service hospital. You can't take it away. It's not a full-service hospital now. It hasn't had pediatrics in years. It hasn't had OB/GYN in years. And there, as I said, there's no cardiac cath. Very often, the emergency department, which is where I worked for 40 of those 52 years, great care, but we can't provide all the services the patients need. So a patient is brought by ambulance, and he could be a surgical patient, and say he's a patient of Dr. Rubin's. And they call him and he said, well, I'm tied up with patients at Salem, you'll have to send him to Salem. So here you go, in that ambulance again, and it's over the trip to Highland Avenue. And speaking of ambulances, I did well, there's 2 thoughts here. I hear the people talking about getting there and all the traffic. Well, if you're just driving there and all the traffic is just traffic, if you need to get there that bad in a hurry, you should be in an ambulance. I've been on Highland Avenue because in my job I would go back and forth to both hospitals, and I've watched the ambulances come up behind me on Western Avenue, and I thought, this is interesting, I'll keep my eye on this. And the ambulance went, and by the time I got to the ER at Salem, that patient was already being taken care of. So I did a little survey today in my retirement time, and I took some addresses throughout the city of Lynn, like the GE and Lynn Shore Drive and different areas of the city of Lynn. And I went to MapQuest and I said, all right, how long is it going to take? What's the difference in driving? And everything was moderate traffic. And the longest difference between driving to Union or driving to Lynn was 7 minutes. And that's the way I would drive. So I can't picture ambulances really causing someone to die because they had to go to Salem. Just like when they closed Lynn, nobody died going through Ioma Square getting to Union. All right, I'm done. Can I say one more thing? Because some of the politicians were not a lot longer than me, and I've talked to some of them, and I don't think they remember. I heard about job closings, and I've been to almost every one of Mr. Norton's coffees that he has, because he's been very open with all the employees since this started. And the employee, and I hear laughter back there, but Supposedly, employees will not lose their job because we need those employees to take care of the patients that we're going to accommodate. And the only one that stands to lose is the SEIU union because it's a different union at Salem. And for the man that was concerned about the extra weight in the ER at Salem, if union closes, the new Salem ER is going to have more than enough beds to accommodate all. So I apologize if no one agrees with me, but I couldn't sit there and listen to erroneous ideas. Thank you.
Thank you for the opportunity to speak. My name is Michael Toomey. I'm certainly not a healthcare expert, but I would like to make a comment on the previous speaker, and that is that one thing I do know about healthcare is that when you replace a hospital with a supermarket, you don't improve healthcare. According to Mass Health Data Consortium inpatient database for patient origin in 2013, Lynn residents were the most frequent users of North Shore Medical Center inpatient beds at 6,713, while Salem residents ranked third at 2,773. Lynn has the greatest need for full acute care inpatient hospital services, and the Mass DPH agencies involved should not allow those essential services to be removed from Union Hospital. The proposed actions and activities should be viewed not as the closing of a hospital floor and the transfer of services to another floor of the same hospital. The actions and activities must be reviewed and considered as they impact two separate facilities at two separate sites. The resultant loss or removal of these essential services from the Greater Lynn region that has served as Union Hospital's primary service area should not be allowed. The discontinuation of services at Union Hospital should not be allowed. Nothing in any of the filings or presentations by North Shore Medical Center indicates that the health care needs of the Greater Lynn region are better served by the expenditure of $180 million at Salem Hospital and $0 at Union Hospital. All of the projected savings appear to result from the removal of essential health care services from Union, while the goal of the Affordable Care Act is to control health care costs. We don't believe that the intent is to remove essential health care services from entire regions and to make these health care services much less accessible. Mass DPH should require more information and further study of the possibility of keeping Union open and spending a portion, possibly half of the $180 million at Union Hospital. Sorry. From 2009 to 2012, Union Hospital averaged $158 million in total charges for inpatient care. This is from the Mass Health Data Consortium. And over $50 million in emergency department total charges from the same source. For the entire period, these figures were in the top 1/3 for all Massachusetts hospitals, including the big facilities in Boston. These figures strongly support the need for continued acute care, inpatient care and ER services at Union Hospital. The closure of Union Hospital will leave the city of Lynn, the largest city north of Boston, all the way up to the Canadian border, as the only city in the Commonwealth with a population in excess of 60,000, and Lynn exceeds 90,000, without a full-service acute care inpatient hospital. The discontinuation of services at Union Hospital is not just a Lynn concern, as we've heard today. The entire Greater Lynn region, including Saugus, Lynnfield, West Peabody, and South Peabody, rely on Union Hospital for both inpatient and ER health care services. Both the Lynnfield and Saugus Board of Selectmen voted unanimously to oppose the closing of Union Hospital. The Lynn, Saugus, and Lynnfield fire chiefs have all publicly expressed great concern over the discontinuation of services at Union Hospital. All were troubled by the lack of access to Salem Hospital and the added time for emergency vehicles and the consequent potential for loss of lives. Lynn Police Chief Kevin Coppinger has repeatedly raised concerns over the impacts of discontinuation of services at Union Hospital, the impact on Lynn's vulnerable populations of poor and elderly. The transfer or removal of acute care medical surgical beds, acute geriatric and adolescent psychiatric beds from Union to Salem should not be allowed, as this action creates an underbedded situation in each of these categories in an urban, underserved area and removes essential services from the Union Hospital primary service area. I'm sorry, thank you. Hey, could I make one final comment? If you want to get a visual of the situation, the best way to plainly see what's wrong with the proposed plan is to view the post-consolidation primary service area map provided by the Salem DON. The map shows Union Hospital right in the center of the primary service area, close to 3 major highways, while Salem Hospital is located in the upper right edge of the map, located closer to the ocean and totally removed from any major highways. This is a major concern. I thank you for your attention.
Good afternoon. I'm the Chair of Emergency Medicine for both the Union and Salem campus. The Emergency Department considered itself an extension of the community and the public. We also are an extension of the Department of Public Health. We're the safety net for the public. We're the only service who can truly say we take care of any patient at any time with any problem. We never close, 24/7, 365 days a year. The North Shore Medical Center, before I discuss the future, it is important to ensure that everyone understands that a full emergency department will remain at the Union campus for the next 3 years during the transition period. Today, the same talented group of physicians provide care on both campuses, and that will continue. During the transition time, North Shore Medical Center will work with those clinicians, first responders, and community leaders to determine the best area of emergent or urgent care services to meet the long-term needs of the community. Whatever comes from that process, there will continue to be local access points. It could be a satellite emergency facility, an advanced urgent care, or a hybrid model, or models that emerge as we study innovative approaches from around the country to configure the best approach for our own communities. The new emergency department on the North Shore Medical Center Salem campus will be there to meet the needs of all and our most complex patients. With appropriate communication with first responders and triage and transfer protocols, consolidation of services will not have a negative impact on patient safety or outcomes, and care will likely be improved with better access to consultative services and specialized care teams. The enhancements of the new emergency department on the Salem campus will provide patients with state-of-the-art care, with more privacy and less waiting time. The new clinical decision unit, or patient unit as it is sometimes called, will enable better continuity of care, providing patients who are likely to go home. A single place for treatment and avoiding the need to transfer to a hospital unit. And the combination of better design for behavioral health emergency care and expanded inpatient psychiatric beds will reduce boarding time and waiting time and better serve all patients. And the same great emergency medicine doctors and nurses and clinical teams will be here to care for all our patients and communities. Thank you.
Hello, my name is Jackie Houston. I am a lab associate at the North Shore Medical Center Laboratory at Union Hospital. I have worked there for a total of 37 years, prior to including Lynn Hospital, 11 years before they closed. I am a proud member of 1199 SEIU United Healthcare Workers East, along with more than 850 of my colleagues. Last year, we provided healthcare services to more than 37,000 unique patients served by the hospital. We thank the Department of Public Health for this opportunity to express our concerns and proposals by Partners Healthcare to discontinue inpatient medical and surgical services at the Linfield Street campus. We want to ensure that any closure or movement of services meets the needs of the Lynn community. That's why we are conducting a community health needs study so that we can all begin to understand the true impact of the proposal. Along with the series of other opportunities, priors, we have communicated directly to Partners executives, and we are discussing with Partners to the community study together. As healthcare workers, our top priority is quality care. We also are advocating that workers whose jobs may be impacted by this potential closure be able to freely choose to form or keep our union if relocated. That means forming a union without Partners spending patient care money to the campaign as we deny our rights. We hope Partners will soon agree that this basic appeal for fairness. Lynn is the largest community hospital in the North Shore, in the medical center service area, almost double the size of the next town, the largest. If the North Shore Medical Center closes, it will be the largest city in the state without a hospital. The frontline healthcare workers who provide critical care as well as receive care at the Lynn understandably are concerned about the healthcare services and the good jobs. We believe our community deserves accessible care and that reflects our diverse needs and a presentation of our quality jobs. We have publicly called upon Partners Healthcare to encourage in a productive dialogue regarding our concerns about the services and the jobs other than the community needs assessment and to complete. We will be better able to discuss the real impacts of closure of the City of Lynn and to its residents. Thank you.
Our next speaker will be Andrea Donovan, followed by Terry McGinnis.
Good evening. Thank you for having this hearing. I'm a senior from Saugus, and I might need that emergency ward for a long time. I don't want it to leave Union Hospital. I had an occasion to be in Union last year as well as Salem. Both were excellent service. But I noticed at Union, they have plaques on the wall stating they were in like the 86th percentile of the best hospitals in America. The service was great. I didn't see those plaques at Salem Hospital when I was there last year. The nurses at Union were great. And one who I happen to know mentioned how the Salem Hospital nurses want to know how they get their service so great. And the service was great, and they seem very happy in their job. But we need that hospital. You're at the axis of 128, Route 1, and 95, and it's just not for the people around here. It's for any people from New England or the United States that happen to get in an accident on those highways. They probably die by the time they get to Salem. I'd like to urge the Commonwealth of Massachusetts to please keep Union Hospital as a full-service hospital, and especially the emergency room. Thank you.
Good evening. Thank you very much for the opportunity to speak before you today. My name is Terry McGinnis. I was born and raised in Lynn, and I'm still proud to call this city my home. I have for many years served as a member of the Board of Trustees of North Shore Medical Center, and for several years was proud to serve as chairman of that board. But I began my association with healthcare in Lynn as a student at St. Mary's High School, across the street from here, working as a hospital orderly at the age of 16. That job helped a kid from a working-class family on Vine Street in Lynn pay his way through college. But even more importantly than my first job, Union Hospital has provided my parents, my aunts, my uncles, my cousins, my extended family extraordinary care for many years. And that experience helps me to understand the real sincerity of the concerns of my neighbors and friends about this planned consolidation. But as a trustee and as a resident of this city, I firmly believe that the plan being put forward by North Shore Medical Center is in the best interest of our community. It will ensure that outstanding care will be provided to our residents by the same physicians, nurses, clinicians who have cared for them for so many years, but now will be able to do so in a state-of-the-art setting. Over my years associated with North Shore Medical Center, I have learned about many significant changes in the delivery of health care. It's changed much from the time I was 16. Care has increasingly moved to outpatient settings, and the care that is left in the hospital has grown increasingly technology-intensive and complex. North Shore Medical Center is a truly remarkable organization and has established innovative collaborations and relationships with our colleagues from Mass General Hospital, a world-class organization. As a result, the care available in this community, in the city of Lynn, is superior to that received in many other communities with large community hospitals. We are fortunate to have this resource, but we must ensure that to do whatever is necessary to preserve it. I believe that North Shore Medical Center must consolidate the most complex care to be able to continue to offer the best care. As a volunteer board, we, as trustees, are accountable for ensuring that high-quality, affordable care is available to everyone in our communities. Thus, we must keep the care that people use the most often close to their homes and easily accessible. This plan enhances convenient, community-based resources with expansion of the North Shore Physicians Group in collaboration with our community health centers, which are exceptional resources for our community, and with the support of other community-based programs and services that will enhance the continuum of care. As trustees, we must also support the management in working with Lynn's elected leadership to ensure the best resource of the North Shore Medical Center Union Campus and the appropriate distribution of emergent and urgent care to meet the ongoing health care needs of the Lynn community. As I mentioned, I have been privileged to be associated with North Shore Medical Center and its affiliates for many years. Based on that experience, I can attest without hesitation that the commitments North Shore Medical Center makes to our communities will be fulfilled, and that the health and well-being of the residents of Lynn and its surrounding communities have always been decisive factors in every strategic decision made by North Shore Medical Center in an ever-changing and challenging healthcare environment. The plan brought forward today to invest in community-based care and to consolidate hospital-based medical, surgical, and behavioral care will create a stronger regional hospital network to care for our communities for years to come. Thank you very much.
Next will be Nancy McGrath, followed by Peter Scheckman.
Hello, I've been a member of the Save Union Hospital Group for about 2 years now, and I see this from a different perspective. Linfield Street is not the right area to put a psychiatric unit, and I say this from experience. I don't like to talk about this, but I think it's very important. My mother started having trouble with my brother. He was sent to a facility in a neighborhood not unlike Linfield Street, given medication for 2 or 3 days, sent home. He'd stop taking the meds, be sent back, be sent home. This went on until he killed her. He killed my mother, And he was found not guilty by reason of insanity, sent to Bridgewater for 7 years, sent back to that same facility, and we all forgave him because we knew how sick he was. He came to see me one day, and he asked me if he could come and live with me. And I said, no, I'm sorry, because I have kids, and I can't take the chance. He poured gasoline all over himself and lit himself up and committed suicide. He was found in back of that facility by 4, 10, and 11-year-old children. I don't think those children will ever forget that sight as long as they live. Linfield Street is not the place to put this, and God knows it's needed. I'm not going to say it's not needed because it is needed. And something else I haven't heard tonight, a lot of the doctors that used to go to Union Hospital are now gone. A lot of the services are now gone, and they've been gone for quite a while. I used to go to Sports Medicine North. I had several joint replacements there, and they don't go there anymore. None of those doctors go there anymore. They don't have the endoscopies. Those doctors are gone. And I have one more thing to say. We should have a given right in this city to have a hospital, the same as we have a right for a police station, a fire station, schools, City Hall, without being here having a fight for it. It's just ludicrous to me that we are here fighting for this, especially since we've already lost a hospital. Thank you.
My name is Dr. Peter Scheckman. I probably know many of you in the audience, or if I haven't taken care of you or your family over the past 39 years, you probably know somebody that I did take care of. So I am speaking to you as someone who is of this community and has lived and worked here for my entire career, and I'm going to address the folks on the stage because that's what we're supposed to do. You've heard so much already that it's really difficult to add a whole lot to this. There's an enormous amount of emotion about the consolidation, but I want to give you the perspective of someone who has been here in the community working for 39 years as well as living in the community. I have had many, many roles in the hospital, both taking care of patients in the office and the hospital with my specialty in infectious disease, but also administratively at the hospital. And some more than 20 years ago, when I was then the president of the medical staff, Lynn Hospital was on the verge of closing. Union Hospital was not as large as it was to begin with. And there was an enormous contraction of the need for hospital services. This was felt by every one of the hospitals on the North Shore. The four of us who were presidents of the medical staff organized several meetings, which were held at the Marriott up in Peabody, and we had a leader of those meetings that was hired. The presidents of the staff, the CEOs that is, as well as the physician presidents of the staff got together. The purpose of those meetings was to consider consolidation of the four hospitals on the North Shore to create a regional medical center which would provide the highest quality medical services. We recognized that many years ago that the technology of medicine, as well as the needs of the community, would demand a single medical center. For a variety of political reasons, that never happened, as we all know. We then had the closure of Lynn. We got to Union. The Union Hospital became much smaller. And I want to second, third, fourth, and fifth what many, many people have said coming up here either knowingly or not knowingly, that our hospital has grown to be a very, very small hospital providing very, very limited services. If I listed the things that we don't do, you would probably say, well, we're really not talking about a full-service hospital at all. We are a hospital that has a very active emergency room. We do have some inpatient beds, but my sense is, now I don't do hospital medicine anymore, but I think our census in that hospital is probably no more than 40 or 50 patients. We are doing very little in-hospital patient care in the city of Lynn. When I speak to my patients in the office and they need service, they may need a subspecialty surgical service, they may need neurosurgical, obstetrics and gynecology, on and on. This is all done either at our medical center in Danvers or at the Salem Hospital. So in conclusion, thank you, what I would say is that we need to make this a very strong consolidation to continue to provide the very best health care that we can in Lynn, which we have done for years, and which we are doing in a very small setting at Union, but predominantly at our primary campus, which absolutely needs to expand. Thank you.
Next will be Lori Martinelli, followed by David Solomon.
Thank you for the opportunity to comment. Yes, my name is Lori Martinelli, and I will just start by saying I know it's very sad for a community to see the closure of its hospital. I say that because I'm from Pittsfield, and me and my family experienced the closure of North Adams Hospital. And that is, unlike this area, it's a very rural area out there, so these are very small towns, had to travel long distances to get to another hospital. But today I'm here to speak on behalf of NAMI, the National Alliance on Mental Illness. Our mission is to improve the quality of life for people with mental illness and their families. And I want to talk about an aspect of the consolidation that is very positive in our view, and that is the addition of the 54 psychiatric beds at the North Shore Medical Center. Our state currently suffers a dramatic shortage in the number of psychiatric beds. This is a statewide crisis that we have, and the proposal here, as you know, is to increase it by 54 beds and also to create a partnership with the Mass General Hospital, which we view as a very positive thing. It's very common with the shortage of psych beds for people to wait days in the emergency rooms for a bed to open up. When a bed does open up, oftentimes it's far away from where they live, so they have to travel long distances. Family members have to travel long distances to see their loved one who is in the psychiatric facility, and these long distances really impede the whole recovery process because they can't see their family members as much as they would like to see. In addition to the much-needed increase in beds and psychiatric beds, this plan will also provide more comprehensive care for patients with mental illness. The new behavioral health center will be located adjacent to the medical hospital, which is highly beneficial for patients with comorbid medical and psychiatric illnesses. Patients at the behavioral health center will have access to specialty medical care on site and need not be relocated to a different site should a medical issue arise. So in closing, I just want to say that the Commonwealth really needs to do its part to provide psychiatric services to all residents of the Commonwealth, and the plan put forth by the North Shore Medical Center will be a step in the right direction. This plan will both increase the number of psych inpatient beds as well as improve the comprehensive services essential for patients with mental illness. Thank you very much.
I am David Solomini Sr. I'm a lifelong resident of Nanny Goat Hill in West Lynn, and I'm here speaking from my heart. Having served on a number of committees and other functions of North Shore Medical Center, Bob Norton, I can freely say that I've seen you do some wonderful things for our community and for the area. This just doesn't happen to be one of them, I have to say clearly. I will not present a written statement at this time, but I'd like to remind everybody present, we thank you for being here from the state. And if you take the words of Her Honor the Mayor, Dan Kale, our City Council President, Tom McGee, our senator, and his colleagues at the state level, as well as others that have spoken. I agree with all of the positive things for our community. As a senior, with the exception of Bill McGinnis, I'm the oldest member speaking today. Seriously, at 80 years old, there are other things considered for the families of patients, and a lot of them in our community are in the senior years of their lives. And to get to another city, it is not easy for them as it is for the ambulance. So we look for the help for those families that need support for their patients. The statistics that Mr. Toomey and Mr. McGinnis presented speak a lot of the needs for this community. So please leave us with our healthcare facility here at Union Hospital. Thank you.
Next will be James Geller, followed by Katrina Paginatakis.
Good evening. My name's Katerina Panagiatakis. I'm from Lynn. I'm a community organizer with Save Union Hospital Advocates, and I'm here in solidarity with the people of Lynn, Linfield, and Saugus in opposition to Partners' plans. I wish I had it in my heart to say thank you to the Department of Public Health. I'm not here to offend the gentleman here, but we shouldn't be here today. Where is the oversight and responsibilities that we depend on the department? First, so far tonight, I haven't heard the explanation of what is an essential service. The legal definition, should I use my minutes or should you use yours to tell the people the definition of an essential service? I'll use my time. Essential health service means the exclusion of skilled nursing facility services, the exclusion of intermediate care, exclusion of cardiac catheterization service, chronic care service, trauma service, medical control service, and other services. Services that need to be in our community. And it's unacceptable that we're holding an essential health services hearing. I am rejecting this hearing because it's not here what we're here for. Save Union Hospital Advocates are to advocate for a full-service hospital, which includes mental and physical services. Those who have spoken out against mental services are not understanding the mission of full-service hospital. We shouldn't be here today because in the last DON in 1997, Partners promised the Department of Public Health that an acute care hospital would remain in the city of Lynn. We shouldn't be here today if we are talking about promises. Thirdly, we shouldn't be here today because in the last DON, the license of the hospital was to remain with Atlantic Care Medical Center. And I don't know if you're aware of this, but a few days after the DON license was given permission, Atlantic Care Medical Center was changed to a different nonprofit organization, and the name of that organization cloned Atlantic Care Medical Center, thereby removing the clauses that stated that the hospital and that general health care needs to be provided by this nonprofit, and the resources, if there's ever a consolidation or a transfer of the organization, that the building and resources need to be reused for the same purpose of the charitable organization, which is a full-service hospital. We shouldn't be here today. There's legal issues. We shouldn't be here today because in August, the community here held a public hearing asking the Lynn City Council to ask the Attorney General's Office of the Nonprofit Division to investigate Partners Nonprofit North Shore Medical Center on those issues and many other issues. And we're asking for an investigation and a monetary redress. We shouldn't be here today because there was no oversight in the past years when services were removed from Union Hospital to Salem Hospital, leaving us with nothing, stripping the services away and then giving justification that it's not a hospital anymore? Where was the oversight? We shouldn't be here today. There's been a lack of responsibility on the Department of Public Health's mission, and I feel like we've been let down for many, many years. We shouldn't be here today because last year, partners lost against the Attorney General's antitrust division that they could not expand in Massachusetts any further. What this means is partners wants to move our services that we built here in our community to Salem Hospital and not allow another provider to buy Union Hospital so there's no competition with Salem Hospital. That's an antitrust issue, and that needs to be brought again to the Attorney General. We shouldn't be here for this. I'm going to wrap my comments up. And we shouldn't be here today because that building is not partners, it's the communities. There's a rich history of the public, and Mr. Solomini's humble. He didn't say that, his family had donated, I don't know how much money to create an emergency room. We had GE held a capital campaign. The Lynn item held a capital campaign. Many citizens of the city of Lynn and Lynnfield and Saugus and other surrounding communities held capital campaigns all throughout time. The benefactors are on the walls, and those resources were built by the community. It's not partners to take away, and that's why we're waiting for the Attorney General to open an investigation, because we're not allowing the services that we built to leave this community. And if partners wants to take those services and leave, we are going to file a civil suit asking for a monetary redress. If they want $200 million to rebuild in Salem, we want $200 million to rebuild the services they took away from Lynn so we can rebuild our hospital here. We're not going away. You can decide whatever you want today and in the next hearing. We're not going to go away. We're going to fight this. We're going to start a civil suit, and we're going to ask the Attorney General to we're going to keep fighting. We're not going away. We have social media. We're going to write it, and we're going to blog it, and we're going to talk about it for many, many years. What has gone, what has happened, and what is continuing. I'm sorry for my anger, but this is my community.
Next will be Darren Sear, followed by Douglas Maitland.
Thank you. My name is Darren Sear. I'm the Ward 3 councilor in the city of Lynn. I've lived here for my entire life. I grew up right off Easton Ave. I live right in the middle between Union Hospital and Salem Hospital. And there's no way it makes sense to make the people from Lynn and the surrounding communities have to travel up Weston Ave and Highland Ave to go up to the hospital, because on any given day, at any given time, you're looking at anywhere from a minimum of a 15-minute ride to a 20-minute ride. And along that route, there are many bottlenecks where an ambulance can't get through, a fire truck, even a police car at times. Along that route, there's a high school. Try going through there at 2:30, 3 o'clock in the afternoon when the kids are getting out of school, or at 4 o'clock in the afternoon when people are coming home from work, or when they're going to work in the morning. Lynn has over 90,000 people living here. In the surrounding community, it adds up to about 130 to 140,000 people. We need to keep a hospital here in Lynn, serving the people of Lynn, not just for the health issues, but the people who work there as well. There's not just nurses and doctors, there's janitors, there's people who work in the cafeteria. And when they say these jobs are going to be continued at the other hospitals, that's a bunch of bull. And, I'm telling you right now that Lynn is always being dumped on. We're being dumped on again. And now the surrounding communities are feeling what that feels like. And when you say it's a nonprofit organization, they're in business to make money. It comes down to money, and that's it. As the Ward 3 City Council, someone who represents over 13,000 people, and in the past week or so, I've received more phone calls that are opposed to this than I received all of last winter with the snow that we had in the city of Lynn. And let me tell you, we got a lot of phone calls because of that winter. So I'm standing here representing those people because they can't be here, and I'm not blaming you, but it is one of the most inconvenient times to be holding these hearings. I'm asking you, on behalf of the people who live in my ward, City of Lynn, Peabody, Linfield, Saugus, Nahant, and Revere, and Swampscott, not to close that hospital. Thank you.
Good afternoon. My name is Douglas Maitland. I live at 41 Lynn Shore Drive in Lynn, Massachusetts. Lynn is the 8th largest community in the Commonwealth of Massachusetts. When I first moved here, we had 2 hospitals, Lynn and Union. We presently have 1, and if a decision is made in the negative, we will have none. The Union campus is one of the most valuable pieces of property that there is in regards to a hospital. It has access to Route 1, Route 128, and I-95. Salem Hospital does not. People in Lynn depend on Union Hospital. Also, people in Saugus, parts of Peabody, all of Linfield need this hospital and that emergency room, which are both open, the hospital and the emergency room, 7 days a week, 365 days in the year. The North Shore Medical Center, our partners, is a domineering monopoly on the North Shore in regards to health care. If Union Hospital is closed, and you help them to close it, the politicians of the City of Lynn have to take the Union campus by eminent domain. After they take it by eminent domain, they have to have a RFP, a request for proposals, so another healthcare organization can come in and take over that campus and make it into a full-service hospital with an emergency room that will be open 7 days a week, 365 days in the year. We need that hospital. Also, with competition, healthcare costs go down. There is not a monopoly. We need competition. Do not close Union Hospital. Thank you.
Next will be Duncan Maitland, followed by Tammy Lander.
Thank you. I'm Duncan Maitland, and I also live at 41 Lynn Shore Drive. I was born at Lynn Hospital, or the produce department in Stop and Shop, as it now is. I also was operated on for a tonsillectomy at the old Union Hospital located in the mansion on the hill. At that time, Lynn had 2 hospitals, and one even had its own school of nursing. No competition existed between the 2 hospitals, only closeness in distance from the facility determined which one you went to. Now, with mergers and consolidations like banks, we have only one hospital that Salem or Partners wants to close. We are the 8th largest city in the Commonwealth. and we need a full-service operating hospital here in Lynn, let alone the dependent surrounding communities of Lynnfield, Peabody, and Saugus. One day recently, taking the 1A turnoff from Route 128 to Goodwin Circle at about 5 p.m., high commute time, in other words, we had to pull over for an ambulance with flashing lights and sirens on its way to Union Hospital. My twin brother and I both said at the same time, can you imagine when or if there were no longer a Union Hospital and that ambulance had to go all the way further to Salem at high commute time before real hospital medical health could be available? We can't, and distance can still make a difference between life and death. Such a disaster is bound to happen if Union Hospital closes. Lynn and its surrounding communities cannot afford for this to happen. Closeness to a hospital facility is all important, and Lynn and our neighbors cannot afford, under any circumstances, to lose the one facility we still have. If Partners is no longer interested in its Lynn facility, then another hospital provider needs to be found who is competition. Competition never hurt anyone, and it could eventually even bring health care costs down. We already have Partners to thank for the closing of Spalding. The building is still there, but the services Spalding provided are no longer available in a hospital facility for North Shore residents. How sad. Do we want the same thing to happen to Union Hospital? I don't think so. Thank you.
Good evening. My name is Tammy Landa. I am a fourth-generation resident. My son is now the fifth-generation resident. I live on 45 Lowell Street. Your so-called Salem Hospital sent me home on a Saturday night at 11 o'clock at night. By 5:30 in the morning, the Lynn Fire Department was called to my residence. They brought me to Union, and within 11 minutes, they decided that I needed an x-ray. I had a collapsed lung. 15 minutes would have killed me. It would have left my 4-year-old son with a 70-year-old disabled grandmother. I'm proud to say that Union fixed the problem. But at the same time, as Mayor Kennedy and Dan Cahill spoke earlier, we are 90,000 plus people. We need our hospital. Yes, we transitioned when they closed Lynn, that my grandmother worked at. How many people died in the first 60 days that it was closed because they couldn't get to Union? I heard MBTA, GLIS, the elderly, the poor. How about we stop charging $25 for the Tylenol that the emergency room gives us, knock down a couple of decimals from the CEOs, and put proper health care back into Union? It's not a full-service facility like it should be. You can't go deliver your child there unless it's an emergency. You have to go to Salem, you have to go to Danvers, you have to go to Beverly, you have to go to Boston. What's wrong with Lynn? What's wrong with Union? As the gentleman spoke before, this is Lynn. This is our home. This is our community. Multiple of generations are raising their children here. We put our hard-earned tax dollars in here, which, of course, our taxes just went up another $300 a quarter. But, you know, we have a school that's sinking, a hospital that's being closed, and Mr. CEO walks around in a suit that costs more than my car. Bring back the big equipment back to Lynn. Stop focusing on Salem, stop focusing on Danvers, stop focusing on all of those other places. Lynn Community Health can't help us 24/7. We need union. Without union, we're back to square one. Thank you.
Next will be Marianne O'Connor, followed by David Roberts.
Good evening. Thank you. My name is Marianne O'Connor, and I reside at 108 Range Heights Road in Lynn. I am a lifelong Lynn resident and currently the Director of Public Health for the City of Lynn. First, as a Lynn resident, I will speak from my heart and say that I can't imagine nor comprehend losing Union Hospital. In fact, I was born in Union Hospital. I remember as a young child standing in the parking lot of Union Hospital waving to my mother in a window when she was having her hysterectomy, because back then children weren't allowed to visit. I remember her back surgery hospitalization and her several hospitalizations due to bouts of diverticulitis, and her final surgery at Union Hospital that diagnosed her bladder cancer. Mr. Norton wants to reassure us that technology has changed the way healthcare is delivered, and there is not the need for inpatient hospitalizations as in the past. While I say a hysterectomy is still a hysterectomy, back surgery is still back surgery, diverticulitis flare-ups are still diverticulitis flare-ups, and not all require specialized care. And that's the story of only one Lynn resident. There's another over 92,000 plus with their own stories. I can't imagine, and I've tried to envision, the stream of ambulances I've witnessed on a daily basis flying through Wyoma Square on their way to Union Hospital, now all flying up Highland Avenue and trying to pull into Salem Hospital. Mr. Norton would also want us to swallow that the City of Lynn is better served and will receive higher quality because of the consolidation of resources. I remember when the city was asked to swallow that same mantra when Lynn Hospital was closed, and residents were reassured that all services were going to be of higher quality because resources were all going to be consolidated at Union. Same story, different day, and now no hospital in Lynn. Someone did die that consolidation, just as I fear the emergency services at Union will disappear. We did that at Lynn Hospital. I worked at Lynn Hospital at the time. We said emergency surgery services would stay 24 hours. And then it was 8 to 8, and then it was 9 to 5. And a young man did die outside the doors of that hospital. He had been a victim of violence and made his way to the hospital hoping he could get saved at that ER, but it was closed. Now speaking as the Director of Public Health, I see a city with great needs. We are incredibly diverse, with over 40% reporting primary language spoken in the home is not English. Many of our residents live below poverty level and are unable to access current services within the city, and now they're going to have to seek services elsewhere. I do not see how this plan addresses health disparities that currently exist, let alone the abundance of health disparity issues the closing of inpatient hospital services and emergency services will bring to the residents of Lynn. Lynn has significantly higher rates than the state average for diabetes, asthma and depression, obesity, higher than state average rates for deaths from overdoses, cardiovascular disease, cancer, infant mortality rates, late entry into prenatal care, substance abuse, STD, and newly diagnosed AIDS cases. And while I applaud the planned expansion of behavioral health and substance use disorder beds, I say too little, too late, and that could and should occur separate from the Union Hospital issue. Please explain how the public health needs of this city are going to be improved with the closing of Union Hospital. Please explain how this improved access to care for Lynn's poor, Lynn's elderly, are non-English speaking, and for those residents suffering from chronic illness. I'd love to hear it. Thank you.
Hello, my name's David Roberts. I'm the Chief of Medicine at North Shore Medical Center and the Chief of Cardiology. I've been in practice on the North Shore for 30 years. I started at Lynn Hospital and moved to Union Hospital and work at Salem Hospital as well now. I'm speaking in support of this for two simple reasons. I want to make one point. The vast majority of the health care that any one of us gets in our lifetime does not involve inpatient medicine. It involves outpatient medicine and diagnostic testing and getting specialists to see us. Most of our care is in the outpatient setting. There is no withdrawing of commitment to the outpatient care of the people of the city of Lynn in this proposal. The idea is to move inpatient care to a consolidated site. The reason we need to do that is the requirements of taking care of inpatients nowadays is so different than when I started. I'm going to give you one example, and then I'll stop talking. When I started in practice 30 years ago, if you were having a heart attack, it didn't matter where you went. Any hospital could take care of it because there was not much to do. And then about 20 years ago, a drug got invented that you could drip through your arm and try to dissolve the blood clot. It worked half the time, so half the time you went on to have a big heart attack. And that's how I practiced cardiology 25 years ago. Well, fast forward to what we do now. So on the North Shore, including Saugus and Peabody, in Linfield and Salem and Danvers and Lynn, if you are having chest pain in your house, what you used to do is drive your car to your local hospital, they put you in a bed, they drip something in your arm, it would work half the time. The mortality rate in those days was over 20%. So you had a 1 in 5 chance of dying from that heart attack. That's how we took care of you. Nowadays, if you are in the city of Lynn or Linfield and you're having chest pain, you call 911. Ambulance comes to your door, they do an EKG in your bed, trained by us on how to do that EKG and how to interpret it. That paramedic says, you're having a heart attack. From that moment, he pages 4 of us, a doctor, 2 techs, and a nurse, in my bed, wherever I am, to start driving to Salem Hospital. So I usually beat the patient to Salem Hospital. Ambulance directly from your bed, bypass the emergency room, directly into the cath lab where I'm waiting for you. And usually within 14 minutes, I have your artery open, stented, fixed, and your heart attack is over. The net effect of that is your heart muscle function is 50% better than it would have been the old way. And the mortality rate of dying from a heart attack on the North Shore has dropped from 20% to 4%. That is consolidated care. Now, what does it take to do that? It takes a $2 million cath lab. Number one, it takes me on call every other goddamn night to do that. And it takes every year updating the equipment so that we can keep up taking care of you in the best possible way. You can't do that in 2 settings. You can't clone me. You can't spend $2 million on 2 cath labs 5 miles apart. So we consolidated the technology and the expertise and people like me in a single setting. And the net effect is from your heart attack. And I can go through, as the chairman of medicine, 8 different other examples of where it takes a consolidated group of highly specialized docs available at a moment's notice, incredibly high-tech equipment to take care of you in a way we never did before. When I started in practice, there weren't any doctors in the hospital. Your doctor managed you from his bed. That's not how we take care of patients anymore. We have full-time physicians in the building 24/7. Specialists on call at a minute's notice to come in and take care of you. That's what it takes to take care of highly sick inpatients. So that's all we're talking about. We're talking about taking the 40 patients who are in Union Hospital right now, moving them into another setting so they can avail themselves of that kind of expertise. All your other healthcare needs are not being affected, as far as I can see, by this move. Thank you.
Next will be Jen Missalori, followed by Karina Coleman.
My name is Jennifer Migliori. I'm a lifelong resident of Saugus. I'm so honored to be here today. I want to thank the Department of Health for hosting this. I want to thank all the elected officials who are here today advocating to save Union Hospital. And I especially want to thank all the residents who are still here 2 hours going strong. I've lived in Saugus my entire life, and I've had the opportunity to visit Union Hospital on multiple occasions, to visit many of my family and my loved ones. On every occasion, the staff, the nurses, the doctors were fantastic. They were exceptional. Most recently, my grandmother died last year, and she passed away in Union Hospital. While my family would have loved to have my grandmother in our home, we were put at ease and comforted by the staff at Union Hospital. I am incredibly thankful for the support and the care my family received during an extremely difficult time. Losing Union Hospital would be a loss for my family, but it would be an even greater loss for the 90,000 plus residents in Lynn and the additional 50,000 plus residents in the communities of Saugus, Linfield, Nahant, Peabody, and Swampscott. These communities deserve a full-service acute care hospital. Right now, Lynn is on the cusp of economic revitalization. The effects of closing Lynn's only full-service hospital will have devastating economic consequences. Healthcare access and good-paying jobs will leave the city. Having the city of Lynn lose one of its largest employers would hamper Lynn's economic potential as well as the quality of life for Lynn residents. No doubt having to travel to Salem Hospital instead of Union Hospital would mean inadequate access to care, as many folks have discussed the traffic implications and how readily accessible Union Hospital is, being with Route 1, Route 128, 95, and Route 129. Salem Hospital only has Route 107. I guess what makes me most concerned about Salem Hospital's inaccessibility is the current opioid crisis that's happening in these communities. Recent data from the Massachusetts Public Health Department demonstrates that of the communities hardest hit by the opioid crisis, Saugus is listed as the 12th and Lynn as the 3rd community for having the most opioid overdoses per capita. I'm deeply troubled by these statistics, and I fear that if we lose Union Hospital, the communities of Lynn and Saugus will lose emergency resources that will prevent opioid fatalities. Let's save Union Hospital and protect the standard of accessible and quality health care that these communities deserve. Thank you.
Good evening. My name is Karina Coleman. I'm filling in for Leslie Greenberg, the Lynn Health Task Force President, who cannot be here today. This testimony is submitted on behalf of the Lynn Health Task Force. We appreciate this opportunity to submit these comments to the Department of Public Health regarding the North Shore Medical Center's announcement of its plans to close Union Hospital, the only acute care hospital in Lynn. For over 25 years, the Lynn Health Task Force has been a leader in advocating for accessible, quality, affordable health care in the city of Lynn. Our focus is on issues of health access for underserved groups, including low-income people, immigrants, the elderly, and the uninsured. Our membership includes community leaders, social service providers, senior citizens, union activists, and representative of newcomer communities. As a community health advocacy organization, we have participated as 10 taxpayer group in several prior determination of need proceedings, as well as other Department of Public Health regulatory proceedings going back to the days of Acute Hospital Conversion Board, in addition to many other advocacy and legislative activities. We understand that the North Shore Medical Center and its parent corporation, Partners Healthcare, have made a determination that it can no longer prudently operate the 2 hospitals it currently operates in Lynn and Salem, and that for a variety of reasons, it is Lynn's Union's hospital that is slated for closure. We are, however, acutely concerned about the future of Lynn's healthcare delivery system as it faces closure of its only hospital. This city of over 90,000 people is the largest municipality in the area and is also by far the neediest by any measure. It has the largest population of people living below the poverty level, the largest population of elderly people, and the largest population of disabled people, the largest population of immigrants, and most troubling healthcare statistics. While being realistic about the eventual closure of Union Hospital, we urge community members and regulators to remain vigilant about protecting and improving our healthcare delivery system. At a minimum, plans going forward must ensure the following issues are addressed. Number 1, preservation of Union Hospital's charitable assets. There must be a comprehensive plan for any assets of Union Hospital and its physical plant to be dissolved. These assets must be used for the benefit of the Lynn community for charitable purposes. If the assets are to be sold, the resulting funds must be placed in a fund to be used to address the unique healthcare needs of the people of Lynn. Number 2, partners must maintain significant investment in Lynn following closure of Union Hospital. Partners has estimated the closure of Union Hospital will save $15 million a year. As Lynn faces the loss of its only hospital, partners must direct a significant portion of the savings to addressing Lynn's multiple unmet healthcare needs. Partners should commit to spending at least half of its savings for the next 20 years, estimated to be $150 million, to improve Lynn's healthcare infrastructure and to address health disparities as they affect the population of Lynn. Spending should be focused on improving health outcomes for vulnerable populations, with a focus on reducing multiple ED visits for ambulatory sensitive complaints, preventing rehospitalizations for unresolved issues, and preventing late diagnoses and subsequent poor outcomes for primary care sensitive conditions. Number 3, partners must assure that Lynn's population is adequately represented in the governance structure of North Shore Medical Center and for the MGH-operated behavioral health unit that will be located in Salem. Lynn has historically been underrepresented on North Shore Medical Center's Board of Trustees and remains so at this time. North Shore Medical Center's 24-member Board of Trustees includes just one resident of Lynn, although Lynn's population represents over 90,000 of the North Shore Medical Center primary care population of 313,000, and undisputably has the greatest unmet medical need. Lynn represents 39% of the usage of North Shore Medical Center, but the Board of Trustees has one member, 4%, representing Lynn. There is no member on the North Shore Medical Board of Trustees with either professional experience or lived experience in health disparities or meeting unmet health care needs. As North Shore Medical Center partners to move to close Union Hospital, it will become even more essential for Lynn's disenfranchised population to have a seat at the table. The Lynn Health Task Force urges North Shore Medical Center partners and the Department of Public Health to incorporate the above-noted issues into plans and requirements for the closure of Union Hospital. While we deeply regret that Lynn's only hospital will be closed, we remain focused on our primary concern, assuring access to needed medical services for residents of Lynn. Lynn is the largest community in North Shore Medical Center's primary service area and faces largest unmet health needs, as well as great health disparities. As we go into the future without a hospital, we urge North Shore Medical Center and DPH to commit to addressing the concerns we have outlined. Thank you for your consideration.
Next will be Sariti Rizzuto and Laura Magoski Marquez.
Good evening to all, and thank you for the opportunity to state my opinion. I will be brief and straight to the point. My name is Saritin Rizzuto. I am here on strong opposition as an advocate for this community, as a person who, along with my family, has utilized the service of the Union Hospital, as a representative of the Latino community, and as a former resident of Lynn myself. I'm still very much invested in this community. I will again state the obvious. The people of Lynn have spoken. Closing Union Hospital is a grave mistake that is not in the best interest of our people. And in response to NAMI, I'm the president of the board of North Suffolk Mental Health. I am all too familiar to understand that there is a shortage and need for psychiatric beds. But there's plenty of places that are more suitable to increase psychiatric beds without taking away the right of a community to have access to quality health care in their own community. Thank you. Oh, and I hope you deny the application.
As Laura is not here, our next speaker will be Poloris Venasantako, followed by Joy McNaughton.
Hi, and thank you for this opportunity for us all to express our concerns. I'm a resident of Lynn. I'm also a proud nurse at Union Hospital. And I love being a nurse at Union Hospital. I love being a nurse there because I'm part of a team that provides compassionate, quality health care to our patients. I'm part of a team that provides care and gets to hear patients say things like, I will never go anyplace else again. I never would have come here, but my surgeon suggested this hospital, orthopedic surgeons, suggested this hospital, and I've had the best care I've ever had in my life. Partners has a goal that they've worked really hard at, and they've done a nice job, obviously, because we give such great care. And their goal is to provide the perfect patient experience. We at Union Hospital do that. I'm not saying that no one's ever had a bad experience at Union Hospital. We're all human, and we're all dealing with other humans and everything that that means. But in June or July of 2015, I can't remember exactly which month it was, the inpatient med-surg orthopedic unit at Union Hospital received 100% in every category on a patient satisfaction survey called HCAP. We were the only unit at either Union or Salem Hospital to ever get 100% in every category. Just yesterday in the Lynn item, Mr. Norton said that he wants people to know and understand that with the relocation of services, the quality of care will improve. 100% satisfaction survey sounds like the perfect patient experience to me. How do you improve on that? Why would you want to close a facility that is already providing the perfect patient experience? Dr. Sheckman was correct about there being limited services at Union Hospital now. But that's because so many critical essential services have been removed from Union Hospital, not over the last 2 years since the plan was announced, but over the last 7 or 8 years, when our surgical floor was closed so that we could bring in pediatric mental health over to Union Hospital. If you want to provide the perfect patient experience, why would you not move a pediatric mental health unit to a hospital such as Salem Hospital that has an inpatient pediatric medical and surgical unit? Right now, if the kids get sick at Union Hospital or if they get hurt at Union Hospital, they have to go to the emergency room, be evaluated, and then be transported to Salem Hospital where they have pediatric services. So that's not providing the perfect patient experience. Let's see, what else? I just feel like it seems like the goal has been to close Union Hospital for a long, long time, that it's not a 3-year plan, as we were told. And you know, the surgeons, I've heard surgeons tell patients not to come to Union Hospital. To me, that seems subversive, you know, that the surgeons are telling patients, don't come here, go to Salem Hospital. I don't know why that's allowed. My own physician, and I know many people this has happened to, physicians are scheduling outpatient procedures and diagnostic tests, simple things like x-rays, lab works, CAT scans. They're saying, we'll go to Salem Hospital to have that done. They're not giving people choice. People still have a choice, and I think a lot of patients, especially the elderly, they don't realize they have the choice, and they should be given that choice. So, you know, I don't know if any of this is orchestrated by partners or if it's just that they're trying to get us ready to move over to Salem and get people in the mindset. But people aren't choosing to use Salem Hospital because that's where they want to go. People are choosing to use Salem Hospital because choice has been removed, and it's been removed for the last several years. So I just want to say, you know, I've had people shrug and say, well, this is the way things are going, and this is how it is. It's happening everywhere. As a nurse, as a consumer, and as a compassionate, caring person, I can't shrug. and say that it's okay for profit to be more important than people. I can't just shrug and say that it's okay for a city as big as Lynn, with a community as diverse as Lynn, and as poor as Lynn. We have a lot of older people with, it's going to be really hard for them to get to Salem Hospital. I just, sure, I can't shrug and say it's okay, because it's not. Lynn needs Union Hospital.
My name is Dr. Mitchell Ryan, and as the Chief Medical Officer, I am here to represent the dedicated physicians, nurses, and clinicians of the North Shore Medical Center. Most of us live in this community. We are your neighbors, and many of our patients are our friends, our families, and our colleagues. I decided to leave a very successful practice in Boston and join the medical staff in 1997 based on a strong belief that the future was very bright for community-based health care. I moved my family of 4 to the North Shore, and we have all received exceptional care at North Shore Medical Center over the years. In 2004, North Shore Medical Center merged the medical staffs of the Union and Salem hospitals. This led to the consolidation and growth of a wide range of specialty practices. Our unified medical staff strongly supports the consolidation of our campuses and understands that the future of community-based health care remains bright as long as we continue to embrace versus resist change. North Shore Medical Center is truly a remarkable organization, and with our Mass General colleagues, we offer care of the highest quality in a community setting. Much of that care is beyond the scope of other community hospitals. We have worked hard to stay current with emerging technologies and cutting-edge treatments. We have been fortunate to recruit and retain a next generation of subspecialized physicians that have been trained with new skills and clinical expertise. We were named to both the U.S. News and World Report statewide and Greater Boston Best Hospital lists. We have been recognized by regulatory agencies, insurance payers, and a variety of specialty societies for clinical excellence ranging from cardiac to vascular to stroke to surgical to primary care and behavioral health. All of our clinical programs focus on comprehensive, compassionate, multidisciplinary, team-based care. If you're having a heart attack, our cardiac catheterization team at Salem Hospital will diagnose and treat the blockage in your coronary arteries, generally in less than an hour. Our emergency room can rapidly diagnose a stroke and, if indicated, treat patients immediately with quality of life-saving blood thinners. Specialists in infectious disease collaborate with hospital medicine physicians to identify the right antibiotic in a timely fashion to facilitate a rapid recovery and avoid the development of multi-drug resistant organisms. Our Vascular Medicine Institute combines teams of interventional radiologists, vascular surgeons, and advanced practice nurses to perform complex, minimally invasive, life and limb-saving procedures every day. A team of talented spine surgeons treat patients with incapacitating back pain as a result of compression of the spinal cord. Compassionate palliative care expertise is available for our most frail and elderly patients suffering from a wide range of chronic diseases. Both elective and emergency state-of-the-art joint replacement surgery is led by specialized orthopedic surgeons. And at the Mass General North Shore Cancer Center in Danvers, world-class cancer care is available here in our community. As you can see, NSMC is a special resource. However, we are frankly unable to sustain this level of highly specialized clinical expertise at 2 hospitals. There is a critical mass of cases that is required for our specialists to maintain their skills and provide patients with the best possible outcomes. The plan we have brought forward today with consolidation of complex hospital-based inpatient and emergency care will ensure that the hospital and its clinicians will be here to serve the healthcare needs of our community for years to come. Thank you for the opportunity to participate in today's hearings and to share some perspectives as both a physician and a member of the community.
Next will be Mark Tatro, followed by Kurt Tankel.
Good evening. My name is Mark Tatro. I'm the fire chief in Linfield. I've been an emergency medical technician for more than 30 years. And I think I can bring a unique perspective to this hearing. I'm not from this area. I started in Linfield about 2 years ago. And so I don't have the emotional attachment to Union Hospital. Having looked at this over the last 2 years, we've been talking about Union Hospital closing for 2 years. And most recently, I determined that Partners really doesn't have a comprehensive plan for how they're going to deal with emergency medical services. We're still studying it. And we're going to have, maybe Union will stay open as an emergency room, maybe they won't. Maybe we'll move it to another location. Maybe we'll have a high-functioning urgent care center. Maybe we won't. I don't know how we can be potentially 2 years away from the emergency room potentially closing and we don't have a plan. To me, if you're going to jump out of an airplane, you should probably know how the parachute before you jump. The town of Linfield is the 8th fastest growing community in Massachusetts. And we have much fewer resources than the city of Lynn. If one of our ambulances goes out of service, it's a significant impact to the community. So we can transport in a rapid manner to Salem Hospital, and I'm fairly confident we can get people there in enough time that it's not going to adversely impact their medical care. But once we get the patient there, there's a problem with turnaround time. So while that ambulance is transporting and while it's returning, it's out of service. So we're relying on maybe another ambulance being in service. But so we transport, we get the patient there, we drop them off, and we leave Salem Hospital and we sit in traffic. And all that time, that ambulance is out of service. So we can take a long time to get back to the station and get that ambulance back in service. So how does that impact the Linfield Fire Department? Linfield Fire Department is the largest community in the North Shore that still has a predominantly on-call fire department. An on-call fire department means that our firefighters, nights and weekends, respond from home, get in the fire truck or the ambulance, and go to the call. Most of them have full-time jobs. So if you can imagine that you're a call firefighter and you get up at 2 o'clock in the morning to go to a call, most times now we can get you back home and in bed in about an hour because we're going to Union Hospital. As a call firefighter, you have to transport to Salem, and you're out for 2 hours or maybe 3 hours because of the longer transport time and longer time to get back. So you do that, and you're out of your house for 3 hours, and you get back in bed, and then the alarm clock goes off, and you have to go to work the next day. If you can imagine, you're not going to do that very long before you say, I can't do this anymore. The full-time job puts the food on the table. So I'm not going to be able to do this. So within 2 years, is the town of Linfield going to have to put more career firefighters on because our call company is not sustainable with transporting to Salem Hospital for all of our patients or Melrose Wakefield. So Union Hospital is our resource hospital. So right now, when we have to exchange medications, our ambulance is still in service. We can go to Union Hospital, exchange our medications, and get back. If we have to go to Salem, we're going to have to put somebody on overtime to go exchange those medications because we can't take the ambulance and just go get them. So we're going to incur costs for that. So I've heard a lot of talk about dollars and cents, and it seems like Linfield is going to a lot of the cost is going to be downshifted to the small community of Lynnfield to absorb. Our call system is very frail, and our ever-increasing call volume and having turnaround time for an ambulance to be 2 hours could be devastating to our system. Like I said, I think we need a better plan for what we're going to do with emergency services before we say, let's close Union Hospital and figure out on the fly what we're going to do about emergency services. Thank you.
Hi, thank you for having this event to the Health Department. Incidentally, my first name is Burt, B-U-R-T, like Burt Reynolds without the money. Okay, I have a letter that I wrote after an incident with my wife.
Can you lower the mic so the folks in the back can hear you?
Here?
Thanks.
Better? Okay, I wrote a letter to the Lynn Daily Item back in October 30th, 2013, and basically it says, Lynn needs a full-service hospital. This is relative to the Union Salem Hospital plan to move mental facilities here to Union Hospital, which we definitely oppose. Our reason is plain and very profound. On October 15th, 2012, my darling wife was sitting on the edge of our bed at 2:30 a.m. I asked her what was wrong, to which she replied, I feel weird. We phoned 911, and the paramedics arrived here almost immediately, followed by the ambulance a short time later. They told me to meet them at the hospital after they would stabilize her. Since we live in the Pine Hill section, I naturally rushed to the Union Hospital to await her arrival, since that is our only Lynn hospital. After waiting what seemed to be an excessive amount of time, I had the Union Hospital receptionist check in order to find out where the ambulance was. I was nearly hysterical, thinking that I had lost her. As it turned out, I was informed that she had been taken to Salem Hospital. Of course, the ambulance drivers didn't inform me that all cardiac facilities had been transferred to Salem Hospital. I was, and still am, and I am now, livid. Here I illustrate an excellent reason to keep essential services at our Lynn Hospital. The services are great, and all the workers, from the doctors and nurses right down to the employees with the most menial jobs, are very caring, helpful, and professional. Never mind partners' attempt to save money. Union Hospital, Lynn's only hospital, should retain all essential services. By the way, we've lived in Lynn for over 44 years, August 1971. And this is the completion of this. There is nothing that partners can say or promise relative to their demented plan for Union Hospital that can justify the plan. You are throwing Union Hospital and the people that patronize its services to the wind and couldn't care less about all of us. Just like many politicians, you have your own agendas. What your plans are for Union Hospital are reprehensible. You have forgotten the Hippocratic Oath and are jeopardizing residents of this area, and will also be putting devoted Union Hospital employees out of work. Get out of Union Hospital and sell to Leahy. Then they will care. Thank you.
Next would be David Ellis, followed by Leslie Quartermarsh.
I want to thank the Massachusetts Department of Health for coming out to do its primary duty, protect the safety and health of our communities. I was a city councilor for 12 years. I was chairman of the Committee on Health, Public Safety also. And in this community, we had hearings that I took part in about closing our hospital in 97. We had 2 hospitals. We were told all the same type of things we were told here tonight, and don't worry, services will be maintained. It was needed. That would not happen. What was happening tonight would not happen. Our need has grown since then. Our population has grown. We say it's 90,000. Census is not that accurate. It's over 100,000 because they don't identify everybody. The issues that we're dealing with opiates is very important. As I'm driving up the street last week, I find a bag of needles, syringes, in the street. Not the first time I've seen it in my neighborhood in Pine Hill. When I'm walking with my son, here's a heroin needle. Somebody got paranoid, threw it out the window with the heroin in it, sitting in a school zone. It's an issue we need local care for. It's hard enough to get those people to get the services they need without going out of the community. We are building services for that. You're adding another clinic on the Linway. If you build it, they will come. There will be more need for that. To save lives, for that population, we need an emergency room. Another issue is, Chairman of Public Safety, we have an industrial area. We have had fires that are historic in nature. We have gas wharfs with gas capacity. We have 2-foot gas lines that's running through this area. GE has 1 million gallons of oil under the ground. There's a lot of areas that can have problems within industrial facilities. We need response for that. We need capacity, emergency room capacity. We need that to keep our firemen safe. We've had a fire, you probably saw in the news, where the whole building, we have old infrastructure from the 1800s. The whole building fell down. You'd think there were accelerants there. They didn't find any. Luckily, the firefighters were just out of range. We need to be able to get them there. My father, a veteran, fought for this country. We have a huge veteran population. You talk about building facilities around medical facilities. We've done that here. We brought the Veterans Clinic here to Lynn. We have the largest veterans group in the North Shore here. They're all very aged now from World War II. Korea, we still have veterans from. They need to have the cardiac care services like my father got at Union Hospital. He wouldn't have gone to Salem. And I'm his kid. I wouldn't have been able to get him to Salem. He benefited from that. My father, for 3 years, lived in the home I built 7 minutes from the hospital because of his cardiac conditions. Very fragile. The community of providers in the hospital kept him alive, so my son, when he was young, had 3 more years with him. It's emotional. Every 2 weeks, I would rush him there. That would save his life and stabilize him. I have EMT training. I took that at Lynn Hospital. I saw the need for EMT training. I've used it in the community. I've saved many lives. At GE, I saw a person I had to do CPR on. Time is of an essence. You know that. It's in the EMT training. How long can somebody go without oxygen? How long can somebody go without having stroke medication or cardiac medications given? If we move this, the same thing will happen like when we move the nursing home. You will have people that die. The oath that doctors give, they see the delivery of services, great services in their medical institutions. I've seen it in the community. Our chief of police has. He says, do not do that. Other emergency safety people in the surrounding communities say that. Former chairman of Safety for Lynn, I say that. This will cost lives. Do no harm is the oath. That's your responsibility. The services, behavioral health, I worked in that area for 4 years. They've already started to close the hospital. They moved from Danvers, the behavioral health, to Lynn. There were no hearings or anything on it. I went out to go to a visit there. It was closed. They didn't even tell providers. It's very lucrative, the Mass Health money under Rosie D. Then they want to move it again and consolidate it all because they get more profit. It's about profit. And when you bring all that and force people, I can't get the service anywhere else because you close in Lynn, it's more profit for them. This isn't about profit, it's about public safety. Supply the public with its safety. If you do this, if you give them their financial deal, it'll cost us Lynn lives and other communities' lives. Thank you. I know you'll do your duty. And the Inspector General should investigate the use of taxpayers' for this Ponzi scheme.